For the hip exam, the knees and most of the thighs should be visible. If symptoms permit, examine the hip with the patient in at least 4 positions: standing, supine, lateral decubitus, which means lying on the side, and sitting. Observe the patient's gait informally as they ambulate before the formal examination or after the exam begins. Note any gross leg length discrepancy while the patient is standing. To do the standing Trendelenberg test, observe the patient from behind. Have the patient stand on one leg at a time. A drop in the pelvis indicates weakness of the hip adductors on the dropped side. From behind the standing patient, palpate the posterior structures, including those superior to the hip and the sacroiliac joint. With the patient supine and the legs flat on the stretcher, inspect the legs for equal length, gross muscle atrophy, pelvic alignment, deformities, swelling, and skin lesions and abnormalities. Make sure the patient's legs are not angled away from the midline, as this will create a false appearance of length discrepancy. For a quantitative assessment of leg length, measure the distance from the umbilicus to the same spot on the medial malleolus on both sides. Use the tape to measure thigh circumference if there appears to be muscle atrophy or the patient has symptoms or signs of weakness. If thigh muscle atrophy is a consideration, measure and compare the circumference of both thighs to detect subtle atrophy. To ensure that the thighs are measured at the same point, measure the distance of that measurement point from a fixed bony landmark, such as the superior border of the patella. Test passive motion for range and presence of pain. With the knees extended, internally and externally rotate both legs. Then, while placing one hand on the anterior superior iliac spine, fully abduct and then adduct the contralateral leg. Next, flex the hip and knee as far as possible while placing your hand on the contralateral thigh. Bring the hip and knee to a position of flexion at 90 degrees and internally and externally rotate the leg. Position the patient in the lateral decubitus position and palpate the area around the joint and greater trochanter. With the patient sitting, test strength, beginning with hip flexion. Next, test thigh abduction and adduction, and knee extension and flexion,